Good morning, Jan. How are you this morning?
I'm doing okay. I wanted to see you. My friend Mary told me about the Council on Aging and how you might be able to help me out. I'm real worried about a situation I have.
Okay. Well, tell me a little bit about it. First of all, are you on Medicare?
Yeah, I've never been sick. I've never had anything happen to me. Always been healthy, but I was gardening. I like to be out in the garden, and I
Okay.
scratched up my arm, and I don't know, it just got real infected, and the doctors can't figure it out. They can't get rid of the infection, so they keep trying new drugs, and I keep depleting my savings. You know, I'm just at my wit's end. I don't know what to do, and
Oh my. Now tell me, do you have a Medicare drug plan?
no, I've always been real healthy. I've always been a really healthy person, and I, do alternative medicine and everything, and I just figured, I'd sign up for it when I needed it.
Well, let me ask you a couple questions. Uh, how long have you been on Medicare?
3 years.
3 years.
Yeah.
And you have not, to date, you have not signed up for a prescription drug plan, correct?
Well, like I said, I've always been healthy. I didn't
Okay.
think I'd need anything like that.
Can I ask you just a couple questions about your income? What kind of income do you have, perhaps on a monthly basis?
Well, my Social Security, it's about $1,500 a month.
Okay.
And, I have my savings, but my savings, I'm starting to use it up, and that's what I'm worried about.
And how much do you have in savings?
About $25,000.
About 25,000?
So not a lot, so I need to, hold on to what I've got.
Well, let me take just a couple minutes to explain how Medicare works. First of all, it's important to understand that Medicare is an insurance program. You can't buy homeowners insurance when your house is already on fire, or you can't buy auto insurance after you've already had an automobile accident. Well, it's the same thing with health insurance. You can't buy health insurance when you're sick or ready to go into the hospital. So the way the Medicare drug program works is that you will be able to sign up for a drug plan. However, you can only do that once a year. And that's going to be during the annual election period, which is October 15th through December the 7th every year. But the coverage doesn't go into effect until the 1st of January.
So am I too late to do whatever it was I was supposed to do?
If your income or your savings were within a certain range, you would be eligible to sign up for a prescription drug plan right away.
Okay.
However, unfortunately, your income and your assets do not permit that, and you will have to wait for the annual election period in October. Now, unfortunately, because you have not signed up for the prescription drug coverage when you were first eligible, there is a penalty involved, and Social Security is going to determine what that penalty is. For every month that you do not sign up for the prescription drug plan, there is a 1% per month cumulative penalty. Let me give you an example. If you don't sign up for 12 months, it's a 12% penalty. If you don't sign up for 24 months, it's a 24% penalty. And unfortunately, Jan, the penalty is permanent. You're not going to be able to get rid of it.
It's
going
not
to
a
be
one-time thing I pay? I mean, how much is that going to
it's-
translate into for dollars and cents for me?
Well, good. Let me put this in perspective.
Okay.
Approximately, you've been on Medicare approximately 36 months. Medicare will determine what the penalty is going to be, but roughly it's going to be about a 35 or 36% penalty. That penalty is based off of a national average, and therefore you can expect the penalty will be somewhere around $15 a month. That will be added on top of whatever drug plan premium that you will pay.
Okay.
So what I want you to do is I'm going to leave you a note here that
Okay.
next October, the first week of October, I want
Okay.
you to call the Council on Aging at 277-8288 and make an appointment with one of our Medicare counselors to come in during the annual election period, and we will help you find a drug plan and get you signed up. But we have to get you from today until the first of the year. We have to see if we can find some assistance. And I've got some ideas here
good.
of some organizations that may be able to help you with your medications.
Okay.
And I'm going to write down their telephone number here, and I want you to give them a call, and let's see if they have some type of program that can assist you with the purchase of your medications.
Anything they can do. I mean, this is killing me.
Absolutely, absolutely. And we don't want you or anybody to have to spend all of your savings for these prescriptions, especially when there is assistance out there.
Thank you. I really need that.
And I think with that, I can't solve all of your problems, but I think you'll be well on your way to resolving this situation with your need for medications.
Well, you've been really helpful. Thank you so much. I appreciate it.
Well, you're certainly welcome. You're certainly welcome. We certainly try to help everybody to the maximum amount possible.